But English at Yoruba. At Yondo. So they'll be asking you questions. So guys, feel free to ask her any questions.
Any questions? Okay, let me quickly introduce myself. Hello guys, my name is Bukola, Dr. Bukola. I'm a junior doctor in UK. First of all, let me thank Mommy Ire for giving me this platform to showcase what I can do most, what I'm passionate about. So I'll briefly talk about the coronavirus for the next few minutes, after which you guys can ask me any question ever. So first of all, what is the coronavirus? Coronavirus is a virus that affects the airways and the lungs. So how is it transmitted? So báwo ni coronavirus?
Don't worry, speak English.
Okay. How is it transmitted? At the moment, a lot of research is going on in order to ascertain how the coronavirus is being transmitted. But at the moment, they've been unable to get how it's transmitted. However, some viruses that are close to the coronavirus, like influenza virus, are usually transmitted via cough droplets, such that like coughing can the droplet, maybe if someone has the coronavirus and the person calls beside you, you can get the coronavirus. But at the moment, it's very difficult to get how it's being transmitted. So what are the signs and symptoms? So the signs and symptoms of coronavirus is fever, high-grade fever, up to about 38.5 degrees centigrade. Cough, brand new cough. So I'm not talking about the cough you've been having previously, but if you develop a sudden cough, it's a red flag for the coronavirus. Difficulty with breathing. You might not be able to breathe properly if you are having the virus. So these three signs, and then fatigue, tiredness, headache, all these signs are signs of the coronavirus. So if you have it and it's getting worse, you should call the emergency number. For England, I know it's 111. For Nigeria, the number it should be on Google. You should be able to Google the number, the emergency number you should call if you have it. So, however, if your signs are mild, you should self-isolate. Self-isolation means staying at home and not having contact with anybody at all. So if you need food or anything, you can talk to someone that can help you get that. Whereas, meanwhile, the person must take universal precautions like ogudo, glove, and all of that. So how can it be prevented? How can we prevent it? So it can be prevented via practicing personal hygiene, like hand washing. The importance of hand washing can't be overemphasized. And then washing your hands for at least 20 seconds under water, using hand sanitizer, avoiding greetings like hugging, handshakes, and all of that. And then cleaning your phone, because, somehow you can, if your phone is contaminated, you can get infected through that. So who are the people at risk of developing high risk of infection? No, let me say, who are the people at risk of developing the infection? Every one of us is at risk of developing the COVID-19. Every one of us. However, out of us, there are some people who are high risk people, such that if those kind of people should develop the COVID-19, it can be life-threatening. So I'm going to be mentioning those group of people, so that those people, they would take high precautions with this COVID-19 we have now. So now, pregnant women are at high risk of developing severe COVID-19. So if you are pregnant, try and practice this self-isolation and see your life depends on it. People who have chronic illness like COPD, asthmatic patients, people who have lung diseases, people who have liver diseases, sickle cell patients, people who have cancer, undergoing chemotherapy, people who have had some sort of organ transplants like kidney transplants, people who are taking steroids. The reason why I mention this medical condition is because they tend to lower your body immunity, and the body immunity helps to fight against this virus. So moving forward, how can it be treated? at the moment, unfortunately, there is no known medication that can cure the COVID-19. However, the symptoms of the COVID-19 can be treated. So, such that if you are having high-grade fever, you could get paracetamol to lower that. If you're having severe symptoms such as difficulty with breathing, you have to go to the hospital and they will give you oxygen or give you ventilator. You must have been hearing ventilator, ventilator, ventilator. The work of the ventilator is to assist you in order to breathe. So moving forward, I've talked about basically everything I'm supposed to say. Okay, so now I think I've already given all the information I should give, and then also let me talk about the how I know I understand that most of you might be worried that how come some people are positive for COVID-19 and they don't have any type of infection at all. They don't have any symptoms at all. The reason is because the COVID-19 is really the symptoms ranging from mild, moderate, and severe. And sometimes some people would have it and they wouldn't show any kind of symptoms at all. They might have maybe mild headache and they wouldn't even know they have it. That is why those people I mentioned, those vulnerable people, the people who are at risk of developing the severe infection, have to be very careful, because it is not everyone who you see that would show you symptoms. It's not everyone you see that will be coughing. It's not anyone who has the COVID-19 already who would have a new cough, who would have fever. Some people will have it and they'll be incubating it in their body. Incubation means that when you have the infection is already in your body, but it is yet to showcase any type of symptoms at all. So thank you very much for listening to me. So I'm now open to take any questions you might have.
Okay. So, but if we are the way they ask us to be inside now, like now, I remember. Okay, is it? I'm coming. Let me see.
Social distancing, Abby?
Of course, everybody knows that.
Mm-hmm.
If you're in the house, I heard some people are saying nose mask is good. Some people are saying it's not good.
I don't understand.
Like, now most people, if they want to go, okay, someone say it's COVID-19 airborne.
At the moment, it's very difficult to say if it's airborne, but then our similar viruses, in the same family, like tó wà similar to COVID-19, they are airborne. Àwọn bí Qatar, like the flu, they are basically airborne. So at the moment, àwọn sure nǹkan bóyá airborne ni o, bóyá foodborne ni o. Only our government, only everybody thinks of WHO decide láti sọ pé let us take all these things, let us be careful with let us take all these things into consideration. Like where if you see someone coughing last days, when the COVID-19 is about to manifest, you might have mild to moderate to severe infection. But when you have mild infection, maybe if the only thing you have is just the headache and the body pains, you can stay inside your house and self-isolate, so that people who are vulnerable wouldn't have contact with you, so that other people who don't have the COVID-19 wouldn't have contact with you. So you can stay at home and treat yourself. Drink a lot of water, take paracetamol, just stay indoor. If you're having body pain, take ibuprofen. You'll be fine. But then when you now notice that it's already getting severe, you cannot breathe very well, you are gasping for breath, you have to, when you get to the hospital, they would likely give you oxygen or and plug the ventilator in order to help you breathe.
Okay. Headache, the symptoms, and coughing.
What did you say?
Hello? Headache, is it one of the symptoms and coughing? Is headache and coughing one of the symptoms?
Yes. The symptoms are headache, fever, any chest symptoms, because the virus affects the upper airways, the lower airways, and the lungs itself. So any chest symptoms like cough, difficulty with breathing, gasping for breath, chest pain are all symptoms of the coronavirus. And then asthmatic patients too, they have to be careful as well.
Is chest pain part of the symptom?
Yes, chest pain is part of the symptoms, unfortunately. New chest pain. Any chest pain.
Can COVID go in itself?
Yes. It can be people who have mild illness, like every viral illness, it's limiting. It would go by have the severe infection. If you have this severe infection, you still be treated and it would go by itself.
If someone experienced ear pain and left after some day, is this sign of it? Pain.
Yeah, because the air is somehow connected to the respiratory system, it could be a sign. And if the ear pain subsides, it's good news. So the person can still stay at home. If the person doesn't have any other symptoms, the person can stay at home.
If someone inhale steamed ginger, lemon, and garlic, does it kill the virus?
Hello, can you hear me?
I can hear you. Can you hear me now?
There have been some various type of meat. Ginger, lemon, and garlic helps, but then there is no scientific evidence to prove that those things work. However, high dose of vitamin C can help to boost your immune system, and C helps to fight against any type of infection that the body can come across. So it's good if you can take high dose of vitamin C just to boost your immune system.
Okay. Thank you so much, Dr. Buki. We really appreciate you. Thank you so much.
Thank you so much for giving me this platform. I really appreciate it. Thank you.
And thank you for coming. Thank you for taking your time. Thank you. So we'll talk to you tomorrow. I'll send you a DM. The time we'll be coming to do this tomorrow.
I'll be very happy as usual. Thank you very much.
Thank you so much. Thank you.
Right. Bye.
So hello.
Yeah, I'm here.
Please, before you go, someone said, please, I have chest pain and cough. And I went to the hospital. I was told I have URCL and I was given drugs. Hope I am fine.
Please come again.
The person said, please, I have chest pain.
Okay.
And cough. And I went to the hospital and I was told I have URCL.
Okay,
and
that's upper respiratory tract. Okay, that's upper respiratory tract infection. It's usually viral infection. So what is the person asking?
The person said they gave drugs. That I hope she's fine.
Okay, yes. The person should be fine if it's actually upper respiratory tract infection. That's like cough, cold, and catarrh. It's usually caused by influenza virus. So that one is not COVID-19. Did they do COVID-19 test for the person?
I don't know.
Okay, so if they did COVID-19 test for her and the test came out to be negative, that's good news. And since Dr. who saw her said it's upper respiratory tract infection, so that's an entirely different illness entirely. That's just common cold and catarrh. So that one to is self-limiting, is to go by itself.
All right, thank you so much.
Thank you.
We'll talk to you tomorrow. All right. So Dr. K or Dr. Blessing, is there